Hi everyone, thanks for joining me for this short introduction to our new article appearing in Rural and Remote Health. The name of the article is Ticking the Box of Cultural Safety is Not Enough, Why Trauma-Informed Practice is Critical to Indigenous Healing. I'd like to introduce myself. My name is Nicole Tujague. I'm a Kabi Kabi South Sea Island person, First Nations person of Australia. I'm co-founder of a small Aboriginal consultancy firm called the Seedling Group, and I'm also a PhD candidate at Southern Cross University in the college called Guinea College of Indigenous Australian Peoples. I'd like to start with some acknowledgements. First of all, I'd like to acknowledge the Yugambeh people of the Bundjalung Nation. That's whose country I'm recording on today. I'd like to pay my respects to elders past, present and emerging, and thank them for the wonderful custodianship of this country that I'm on today. I'd like to acknowledge Kelly Ryan, my sister and Indigenous psychologist. Kelly helped me to write this paper. I'd like to pay my respects to Dr. Sean Wilson, my principal supervisor, and Dr. Stuart Barlow, my second supervisor, both who work at Guinea College of Indigenous Australian Peoples in Southern Cross University. How did this study come about? This study is part of my PhD research on Indigenous evaluation, but this paper came about through that research with a group of stolen generation men in Australia. The connection between operating in a culturally safe way and understanding about how psychological trauma affects the brain and the body was critical throughout this research. Without a deep understanding of trauma, it would have been impossible to carry out the research safely within this group. The paper is also informed by the work on the ground that the Seedling Group has been doing for the last 8 years in community, at schools, shelters, legal services, and many other organisations, talking to people about trauma-informed practice. When we look at the history of cultural safety practice in its many forms, and we have cultural awareness, cultural sensitivity, cultural competency, cultural humility, and the list goes on. Organisations have been training their staff since the 1970s, yet we know that the health disparity and social determinants such as housing, rates of incarceration, rates of employment for Indigenous Australians is different to that of other Australians, and the gap continues to widen. The key messages in this paper are firstly that cultural safety is not achievable without understanding the effects of historical, such as colonisation, historical trauma, and current trauma resulting from racism, both interpersonal and systemic. Secondly, for First Nations peoples, understanding trauma empowers us to understand our own lives and enables people to seek resources that they need to heal. All the training out there of cultural sensitivity, cultural awareness, cultural safety, it's all critical, but we can't stop there. We need to look at how trauma impacts our understanding of cultural safety. What are the implications of these findings? The implications of these findings are that we need to ensure that those working with Indigenous clients and Indigenous people themselves have access to training that gives us a trauma lens. Operating in a trauma-informed way allows us a better chance of cultural safety. So what needs to happen next? We need to develop and evaluate training that equips us with a culturally safe trauma-informed lens. And this is critical when working with Indigenous peoples if we expect better social outcomes and healing to happen. Thanks everyone for listening. I hope you enjoy the paper.